Novartis Access was launched in September 2015 in Kenya, followed shortly by Vietnam and Ethiopia, with the intention of rolling out the program to 30 low and middle-income countries. With this program, we aim to focus on improving accessible health. We will offer a portfolio of 15 on- and off-patent medicines addressing the 4 main non-communicable diseases. So non-communicable diseases are known as chronic diseases, and they're growing increasingly in low and middle-income countries, mainly in Africa. Around the world, 38 million people die each year of one of these diseases: respiratory, cardiovascular, diabetes, or cancer. One of Novartis's contribution to the Sustainable Development Goal is the launch of the innovative Novartis Access program. We have selected products, medications from the World Health Organization's list of essential medicines and included those in the program. We will offer those products to government, public sector, healthcare providers and NGOs as a basket at a cost of $1 per treatment per month. These products are among the most commonly prescribed medicines in those countries.
Diabetes is an escalating global challenge. In 2014, about 387 million people were affected by the disease, and this is expected to increase to nearly 600 million people in 2020. Gestational diabetes, mainly a temporary form of diabetes, is also following this increasing trend. Low and middle income countries are the most affected by gestational diabetes, such as Guinea, Brazil, China. If untreated, gestational diabetes may lead to increased complications for mother and child. The Changing Diabetes in Pregnancy program by Novo Nordisk was started in 2009, and today we have already 30,000 women that were screened for gestational diabetes. We also aim to raise awareness, invest in lifestyle education and training for healthcare practitioners. And a good example is Nicaragua, where nutrition, diet and exercise are now an integral part of the maternal health follow-up, and also dietitians play a central role during the hospital visits. Novo Nordisk has clearly the ambition to further invest in the improvement of maternal health, which is part of the SDGs.
Epilepsy is a brain disorder which makes people more prone to develop seizures. It is a very common disease. About 70 million people worldwide live with this condition. Only 10 million people have access to good care. That means that 90% of those people in developing and low and middle income countries have no access to care. And that is where UCB wants to make a difference by offering education, treatment, and diagnosis to those patients in countries such as Congo, Rwanda, Mozambique, Myanmar, and China. To give an example, in Rwanda, we support initiatives that do the education of the communities, the grassroots healthcare workers, the district hospitals, and the tertiary hospitals. In a kind of a pyramid approach, we bring education, access to diagnosis, and with the support of the government, access to treatment. At UCB Belgium, in Braine-l'Alleud, we have research units that are focused on the Sustainable Development Goals, namely access to healthcare for all ages. And they do pioneering work with different partnerships that they have established.
My name is Sam Proesmans. I'm currently working as a resident in internal medicine, specializing in infectious diseases. And I've done a couple of projects in developing countries, of which the Flying Doctors, where we brought a flying ambulance from Belgium to Congo, is probably the best known. There is a collaboration between the pharmaceutical industry, NGOs and local people, but history has proven that collaboration sometimes can be difficult. But I think that's a problem of the past, and now everybody's more engaged, more open in collaboration, and I think really that's the way we should go to, and I think we're succeeding in that. What I expect from the pharma industry is that they keep investing in R&D, like they did recently, and like they proved recently with treatment and prevention drugs for Ebola, for hepatitis C, for example, and keep spreading and making these drugs available for every person worldwide. I've seen some very good examples in South Africa where people were literally dying, and in a couple of years' time, or a couple of months even, they became very healthy human beings due to affordable anti-HIV drugs. So it's very possible, and it's proven every day.
River blindness is a parasitic infection by a worm that's called a filarial worm. And the trouble with this worm is that it creates lots of larvae. The larvae get in the skin and the eye, where they can cause changes eventually of the skin and even blindness. The Medicine Donation Program is, as it says, it's a program for distributing medicines which are used for the control of the disease. It does not kill the adult worms that create the disease, but it kills the larvae. So it prevents blindness and it prevents some of the major skin changes. So the drug is distributed to anyone who has need of it for river blindness or also for lymphatic filariasis as part of the donation program. If you look at the Sustainable Development Goals, number 3, which relates to health, that's really important. This is a disease we can get rid of. This is a cycle of poverty we can actually break. Over 28 years of the program, there's been scaling up every year. And with regard to river blindness, we are almost at treating the total number of people we need to treat. These are the people at risk. It's somewhere around 140 million people, we think, at the moment. We have a target, 2025, to get rid of river blindness in Africa. May be difficult in some countries like the DR Congo or in South Sudan, but other countries we're pretty much on track. We're pretty hopeful.
Pneumonia is the leading cause of vaccine-preventable death worldwide for children younger than 5 years of age. Pneumonia affects children, but also their families everywhere, but mostly in South Asia or the sub-Saharan African region. And most of all, pneumonia can be prevented by immunization. Pfizer aims to reduce child mortality, which is one of the SDGs, by supplying 740 million doses of our pneumococcal vaccine to developing countries through 2025. We're proud to work with the Gavi Alliance and with UNICEF to reach children in the most remote regions in the world. Manufacturing 1 dose of our pneumococcal vaccine is very complex. The high-tech production facility in Puurs in Belgium is focusing on sterile manufacturing and a competitive strategy. We pair quality to a competitive cost and a high supply reliability by having highly automated production units controlled by strong teams of motivated and skilled people. This is how we are proud contributors to the worldwide prevention of pneumococcal disease for children.
Doctors of the World is an international NGO that ensures universal access to health. In the countries where we work, we want to reduce the morbidity and the mortality of the most excluded people. For example, we have a very important project in Congo, in the hospital of Panzi in South Kivu, with Dr. Mukwege, a winner of the Sakharov Prize, where we treat women that are victims of rape. And we already treated more than 1,000 women in this case. Doctors of the World tries to improve the cooperation with several actors through partnerships with civil society and also with the private sector, also through advocacy programs that focus to improve the accessibility of essential medicine at affordable prices to vulnerable populations in Belgium and also in the south. In the south, we work on a project that's called QuaMed in cooperation with the Tropical Institute in Antwerp. The objective of this project is to ensure the quality of medicine through different factors, the traceability, the productivity and the storage of medicine. In the south, a lot of medicine are false, and this is a real threat for vulnerable people. So global health and the climate agenda are for sure intrinsically related. Changing climate patterns, rising sea levels have a huge social and economic impact on countries in the south, and especially the poorest and the most vulnerable people are affected by this. Therefore, Doctors of the World included environment as a very important factor in its new strategy.